Hello to the viewers. So with me, I've got Dr. Gautam, who has secured rank 109 in INI CET November 2025 exam. So Gautam, welcome and hearty congratulations.
Thank you so much, sir, for the blessings, and thank you for having me here on the platform.
Right,
Really happy to be here.
right. So Gautam, the viewers would like to know more about you and your journey towards this amazing rank. So let's start with your MBBS college and which place are you from?
So I'm a resident of Delhi, and I did my MBBS from Maulana Azad Medical College. I joined in 2019, and I completed my internship in April 2025, and then first appeared in my INI CET exam in May, in which I got a rank of 277. Then I appeared for NEET PG exam in August, in which I got a rank of 607, but wanted to try out for the central institutes again. So and with the delay of counseling, I could appear for the November INI again. And in this exam, I got AR of 109.
Right, right. Great. So amazing ranks that you've got. And coming to your journey with DocTutorials. So we know that for INICT, it
Mhm.
requires good level of understanding. And for this exam as well, I felt though the exam looked easy superficially, but at least for certain questions, the options were a bit tricky and they were testing the understanding on a deeper level as well, right?
Yes, sir. Definitely, sir. INICT does certainly has more in-depth questions, more interdisciplinary questions across the various subjects, which requires you to have a deeper understanding of the subject. And moreover, major focus is on the pre and paraclinical subjects. Like there is a generally a more percentage of first and second subjects, like 60-40 ratio is there. So, and this year also the more difficult questions were from these subjects only. So I feel that for those subjects you need adequate understanding of the subject and reading of standard textbooks and good lectures, which will help you to understand the topic well
Right.
and practice adequate MCQs also.
Right. Right. So, coming to the lectures, the video lectures in the DocTutorials app. So, out of the lectures, any specific faculty mentions or video mentions that you have got in your journey?
I would like to say that Vandana ma'am's lectures, so your lectures, and for anatomy, Dr. Rajesh's lectures were pretty spectacular for me, both in terms of covering all the concepts and explaining in them in a way that makes you understand it with a better clarity, so that you don't get any question wrong in the exam. You're presented with like in a broad perspective, so that you are not just like learning the concept but applying your mind also, so that even if the question is twisted, so that you can think out of the box and answer that question. That
Right.
was, I felt, that was present in, especially in your lectures and ma'am's lectures and Rajesh sir's lectures, which helped me uh,
Right.
to tackle the questions in the exam.
So, coming to individual lectures, when it comes to medicine, like what actually you found unique in the medicine lectures in the DocTutorials? Did it actually help you to have a good understanding of the subject rather than just some sort of MCQ preparation alone?
It helped me because I saw the lectures were in like very and divided into the various topics, so that like you could like see each topic in great detail. The videos were long, but I think that the purpose of the video is not to just solve the MCQs, but also to grasp the concept, because ultimately when we'll be practicing, those concepts will be helping us, not the MCQs. So I feel that in addition to be able to solve the MCQs, we should have a deeper understanding, which the lectures provided me with in the form of subject topic wise division, so that like they were of some were of long duration for the bigger topics, and some were of short duration, so that you can watch more lectures in the go and revise them properly later on.
And what about the revision videos? Because obviously, medicine is a vast subject. So to have a concise understanding, revision videos can actually help you. So how did you find the QRP videos in the DocTutorials app?
The revision videos were pretty thorough in the sense that I feel that they covered the major topics that are generally asked in the exam, and they were very exhaustive in that sense also. And I felt that I was able to cover them pretty nicely before the exam, because that is the I feel the purpose of the revision videos, to just because for making the concepts you need the main videos, but for revising the concepts I feel that revision videos were a key part of my journey.
Right. And what about the anatomy videos? Like, again, INI CET is slightly tilted more towards pre and paraclinical subjects. So, how did you like the anatomy lectures?
The anatomy lectures were full of the I felt that line diagrams as well as the cadaveric images, which helped me to first of all gain a perspective, like just let me imagine uh, the anatomy in the in my own space. And then also, like by seeing the cadaver later on, I was able to visualize what all structures had mentioned in the line diagram, so that I was able to replicate that. It became easier later on to imagine those structures and not make a mistake later on. And such lectures are pretty exhaustive, which would also be helpful in the normal uh, lectures, not just for the MCQs, for not just for solving MCQs, but for also developing a greater understanding of the subject. And of course, like he made me fall in love with anatomy, because I remember, like, initially I used to like not like it very much, and I used to like fear the subject. But with sir's lectures, I was pretty much confident in solving the questions. Even though I know the in this November INI CT, the questions were pretty tough, but I was able to solve many of them because of sir's thorough explaining and the use of line diagrams, which is just simplified for me, because not I don't always require a uh, uh, big image. You can if you have a understanding with the line diagrams also, you can apply it. So that is what sir did, and which was really useful for me.
Right. And what about pathology lectures in the DocTutorials app? Pathology, again, being an important subject for INI CET.
Ma'am had really focused on the major topics which are asked in the INI CT, and which can be asked in the INI CT. And what I especially liked was the uh, like deeper coverage of the concepts from Robbins, which is the essential textbook for pathology, and from which lots of questions are generally asked. And I really saw when I was solving the past year questions that I was able to solve many of those questions because of ma'am's really amazing lectures. And moreover, she used to give really good predictors, like which can be asked in the INI CT. So that is why I felt that even I could also solve many of the questions of path, which I might not have been able to solve had I not watched ma'am's lectures. So I really would like to thank her for that.
And did you attend ma'am's quizzes as well that she used to conduct?
Yes, definitely. I remember I did not used to score very well, but as I watched lectures, as I revised, I was able to score pretty well. I was able to solve like 85 to 90% of the questions, which I felt was a pretty good score. And considering when I was like getting just 50 to 60%, and then jumping to 85, 90% was significant for me, and hopefully helped me with a good rank in INICT.
And Gautam, if I may ask you, like in your preparation, this is what many students ask me, that is, when you prepare for such an exam, do toppers have bad days as well? Like, have there been days where you had self doubts? Did you think that will I be able to make it, or was it like just like a red carpet?
Definitely, sir, there are bad days. Definitely, there are many bad days. Like, there's not just a few, there are many bad days, I would say that.
Right.
But I just feel that even on a bad day, you should feel that, like, it is just a day. And, like, there are, like, I would say that each day is a new opportunity. Like, I used to say, I like, used to, like, prepare myself that in, like, for an exam, like, each question is an opportunity for you to score. Similarly, each day is an opportunity to do something, even if you're not able to do much. Like for example, if you're not able to study or not feeling well, so that just on that day just revise something or just solve some MCQs, so that you feel at the end of the day, you feel I did something, I did my best. Because
Right.
the best may not always be like studying for long hours or like doing many topics. The best changes every day. Like my, if I feeling good on a particular day, even if I study 10 hours, that may also be less, that may not be also my best. But on a bad day, even if I'm studying for 2 hours or solving less questions, that may also be my best. So I just motivated myself to do something each day. Not it may not always be like what I imagined, what I expected, but on the long run, I see that it will pay off. Eventually, it will pay off.
Right. So, in your journey and to this top rank, you might have done multiple study strategies, some of which
Yes.
might have worked, some of which might not have. But is there one tip that you want to give to the future aspirants on something that worked for you? Obviously, it is
Hmm.
your take, but any particular strategy that you feel, this is something that you should be doing when you prepare for INICT. Any particular strategy?
I would say focus heavily on previous year questions, both of NEET PG as well as INI. Whether you're preparing for NEET PG, whether you're preparing for INI, you should look at both of the previous year questions and the previous year topics well, because in these exams, the sometimes the questions may be repeated verbatim or in the form of the previous year topics, and they will give you a huge advantage when you're sitting in an exam which is of in a very short duration and like literally life determining exam, I would say. And secondly, practice more and more GTs, or because for the exposure of questions, understanding your weak topics, but also for time management, because in particularly in INI CET, they will have 50 questions in 45 minutes, which is roughly less than a minute for each question. So to do those questions in that particular time frame and revising them, so and moving to the next section, because you cannot see that question again. So
Right.
practicing more and more MCQs will help you to speed your pace and pick out the keywords, so that later on when you are uh, solving the question in the main exam, you don't get stumbled by some options which may not know. You'll be able to pick out the keywords, so that uh, you are able to solve the question pretty fast, and hope you get a great rank then. Hope.
Right, right. So I think very useful insights, Gautam, and I'm sure that the
Mm.
aspirants listening to you might have also been benefited, because that is what you best can do to motivate your juniors and to
Yes.
guide based on your experience. As I said, certain strategies would have worked for you, certain strategies might not have. But when toppers like you give directions to the future aspirants, it definitely helps them as well. So thank you so much, Dr. Gautam, for joining and sharing your insights. So all the best for your future. Okay.
Thank
Bye
you so
bye.
much, sir. Thank you, sir, for the blessings.
Bye.
Yes.